the healthcare system is vast. There are many, many participants in it, many healthcare providers and organizations and staff members, and many places that patients can seek care. So they may be living at home, and they may have home health come into their home, or they may go to an adult daycare facility, or they may move into an assisted living setting like you have here, or maybe into the extended care setting. They may get sicker and may find themselves in the hospital, and maybe from the hospital they'll be discharged to a rehab facility or a skilled nursing facility status. So patients move through many different organizations, many different healthcare providers. And the problem with that is that each of the healthcare providers has information on the patient, and that information is stored within their organization in their own silo. And they don't communicate well, and that's a problem. What they've done a lot of studies looking at this, and what they've realized is that when people are admitted to the emergency room, it turns out if the emergency room doctor knew all the information about the patient, say from what was going on in the nursing facility, about 15% of the time that they were going to admit them, they wouldn't have had to admit the patients. They would have realized, okay, this is something that's been going on. We understand it now. We don't have to admit it. And there's a problem. It's not just on our end when we're sending patients to the emergency room, but it's also with the hospital. As they're sending patients home from the hospital, it's been estimated that there are millions of mistakes that are made, where there was a plan to do something each year, and the patient's supposed to continue taking this medication, or they're supposed to stop this medication, or they're supposed to get this test, or they're supposed to have this follow-up. And of those millions of times, 1.5 million times, there's a problem, an adverse event that happens to the patient that could have been prevented if we appropriately communicated information to whoever's taking care of the patient next. So this problem of not communicating as patients are moving is a huge problem. It's costing billions of dollars each year across the country, injures millions of patients across the country. And Massachusetts is as bad as everywhere else. It's estimated we waste $500 million every year in Massachusetts for things that we could have prevented if we had communicated information properly as the patients transition. So, this is a nursing facility, and you guys are dealing with the sickest patients. The very sickest patients are the ones that are in the hospital. And it turns out that for Medicare patients who are hospitalized each year actually make up 75% of all of Medicare's costs. And of these sick patients, 40% of them end up either in a nursing facility, skilled nursing facility, or home health, somewhere in this long-term post-acute care setting. So the sickest patients are coming through here, and so you're responsible for caring for the sickest and most expensive patients in the healthcare system. And so the federal government said, this is a problem. We're wasting billions of dollars. We're hurting millions of patients every single year. It's all because we're not communicating properly. So how do we improve the communication as patients move across the healthcare system? And so they came up with this idea, which is embodied in IMPACT. It stands for Improving Massachusetts Post-Acute Care Transfers. But the idea was the project is supposed to figure out, how can we improve the flow of information from the doctor's office to the hospital, from the hospital to the nursing facility, from the nursing facility to home health, for wherever the patient goes, and then back to the emergency room. How can that information flow there? So as part of that project, we realized there are a few different pieces. One is we needed to find out what is the information that needs to flow. What do we need to tell the next person that we're passing the patient to? And then the second thing is we'd like to do this electronically because it's been very efficient, to use electronic telephones and the internet, and maybe we can also be conveying patient information electronically. So what is the information that we need to send, and then what are the tools that we need to send it? Just like a soft, telephone or a fax machine, these are all tools. If we're sending these electronically through our computer systems, what are the software tools that we need to move this information? We're testing this in Worcester County. You are one of the pilot sites that's testing this. We're not testing this with every organization in Worcester, and certainly not every organization in Massachusetts. So you're part of an elite group, and that's one of the questions on the test, is that it's only a subset of the group organizations in Worcester that's doing this. And then we're going to measure the outcomes to make sure it really makes a difference as we expected. So of the sites that we picked sites that already were exchanging patients with each other, and so we have 16 organizations that are participating in the pilot for Impact. We've got St. Vincent Hospital and UMass Memorial Healthcare Center. So their emergency room in their hospital for receiving and sending patients. We also have Reliant Medical Group, where I work. Remember, we used to be called Fallon Clinic. And then also Family Health Center of Worcester, they're also participating in this. We have 2 home health agencies, VNA Care Network and Overlook VNA. We have Fairlawn, which is an inpatient rehab facility. We have one health plan, Found Community Health Plans participating. They have care managers who, when patients are discharged from the hospital, if they're dual eligibles that they're working with, both Medicare and Medicaid patients, they'll be receiving summary documents sent to them so they can help coordinate care after discharge. And then we have 8 skilled nursing facilities and extended care facilities. So alphabetically right at the top is Beaumont. We have Christopher House, Holy Trinity, Jewish Healthcare, Life Care Center of Auburn, Millbury, Notre Dame, and Worcester Rehab and Healthcare Center. They used to be called Radius, they changed their names a few times. And so all of these are the pilot sites, and these are the only nursing facilities that are in the pilot. We figured, so getting connected, we said, okay, what are the software tools that we need to connect? We actually did a lot of analysis on what are the data elements, and we did surveys actually around the world, getting input as to what are the data elements that people need when they receive a patient. And we're actually creating new national standards based on the work that we've done in this project, and they'll actually be published in April and will be used all across the country. So the work that we've done here in Massachusetts has been very, and Worcester Worcester County has been very impactful for the nation. And then we said, okay, what are the software tools that we need to convey this information? And so we've got a few different ones. There's tools called Land and Sea. This is because it's Massachusetts. You know, we have 1 if by land, 2 if by sea. So that's why we named it Land and Sea. Land is something that you won't be using in a nursing facility, but it's an adapter for hospitals and physician practices that have electronic health records. And if they've got an electronic health record, we found that it's not that easy to necessarily just plug it into a health information exchange network. You know, you've got your home computer, you plug it into the phone or the cable system to connect to the internet. Well, healthcare system, electronic health records, can't just plug and play that easily. And so we created LAN as an adapter that they plug into LAN, and then LAN connects them to this secure network. In Massachusetts, the secure network is called the Massachusetts Highway. And that's how we send medical information between organizations. So LAN helps EHR, electronic health record using organizations, connect to the highway. For people who don't have any electronic health records, which is actually most nursing facilities, they don't have electronic medical records. So they need some other way to connect to the highway, so that when the hospital sends an electronic summary document through the Mass Highway, sending it to you in your nursing facility, you need a way to receive it. You need to have something to catch that message, and that's what C is. It's like an electronic medical record light, like it's a really very thin version. Maybe a better way to think of it is it's more like a Gmail mailbox or Hotmail or Yahoo Mail, where mail comes into it. And it's very similar to that. You know, it's got attachments, and you open up attachments, and those are the summary documents that came from the hospital. And I'm going to show you exactly how you're going to be able to do that. The other thing about C is that it's easy to use because you're going to use a web browser. So you don't need any fancy software load on your computers. You just use any computer with internet access. You use a web browser. You go online and you can see your mailbox. The other thing we've set up is that you can actually get a text message. So some people will be getting a text message saying, "You've got mail." and then it reminds you to go ahead and log into your account. There's one mailbox for the entire organization, but each of you who are using it will have your own individual password to log in. You'll all log into the same mailbox, you can all be logged in at the same time, but each of you have your own user ID and password. So right now, the Mass Highway, that's their logo. This first phase is that it's working on sending messages, pushing messages, kind of like a fax machine, just pushing it from one place to another. That's what the highway is doing right now, is it's allowing us, the hospital to push a summary document to a nursing facility, or a nursing facility to push that summary document to the primary care physician, to the emergency room, to a home health agency, wherever the patient's going next. And that they can be sent to land boxes to get to an electronic health record, or it can get sent to a C mailbox. Now the mailboxes are called web mail. So I may use this term web mail, and that's really the mailbox that C is glued to. And I'll be talking a little bit more about that in a second. But the highway's live. It's been live for a year. This is our Governor Deval Patrick. In October last year, he had his medical records sent from Mass General Hospital to Bay State, which is in western Massachusetts. So his was the first record to be sent across the highway. And here are a bunch of 100 people celebrating that moment. And right now there are about 47 organizations connected to this highway. There are another 200 more, including yourselves, about to get connected to this. So while you may not be able to connect to everybody in Worcester, you certainly can connect to all 247 organizations that are connected to the highway. So as soon as you connect, now you're connected to all those other people as well. If you needed to, you could send it to them, or they could send messages to you. You could getting a patient who's discharged from Mass General Hospital, they could send you a summary through the Mass Highway. There is one other tool that's out there that you may or may not be using, and it's called the Key High Transform. What we recognized is that in nursing facilities, you guys have MDS assessments that you're doing. You're periodically assessing the patient's functional status, their cognitive status, their wound status, and you're recording that. Now right now you're doing that for billing purposes, but we recognize that, well, that's clinical information, and it may be something that would be useful to pass on to the next person. If you're sending a summary document to a home health agency, if you've already recorded the wound status in the MDS, maybe you'd want to take that information, put it in your summary document and using C, and send it off to the home health agency so you don't have to type it all in again. So there is this product, and some of the organizations are going to be trying this out. And what it does is it converts it into an electronic summary document that basically gets mailed to your C mailbox so that you can use it. And I'm going to show you how you'll do that if you were to choose that later on in the training. So I'm going to talk about that summary document that, say, the hospital is going to send to you. And it has a few different names. I may call it a transfer summary, maybe it's called a CCD, maybe I'll call it a CDA. They're all groups of the same thing. CDA is just a particular type of document. Just like, you may get an Adobe PDF document, or a Word document. Well, there's something called a CDA document. And it comes in a few different flavors, and it can be CDs or transfer summaries or discharge summaries. So there are a few different things. But from your perspective, just think of all of them as the same. So I'm going to show you what it'll look like, how to view one that the hospital just sent you, and then how to print it out, because presumably you're going to receive it and you're going to want to print it out and use it in your paper records. Then I'm going to show you what is, let's say 2 weeks later, the patient is, maybe they're getting ready to go home, and you're starting to plan their discharge, and you want to make a transfer summary that you're going to send to the home health agency. I'm going to show you how you can actually start using the one that came from the hospital as a starting point, because that's got all the patient's name and their address and their phone numbers and their med lists and their allergy lists. So you can actually start with that and then just update it, showing things, okay, well, we stopped this medicine, we started this medicine, we now know they're allergic to this medicine, their wound is now looking like this, their functional status is looking like this. So you can basically update what you got from the hospital, so you don't have to start from scratch. So I'll show you how to do that, how to find it. And and then I'm going to show you how to edit it, how to send it. I'm going to show you that you can also do one from scratch. You know, you've got, this is also an extended care facility, you've got, you know, these aren't all SNF patients, skilled nursing facility patients. Some of these people live here, maybe aren't starting at the hospital, they're starting here. And that if you wanted to send them to the emergency room with a summary, you could start from scratch and create one of these documents. And then I'll show you, if time permits, how to merge information from multiple documents. If you wanted to merge from the hospital node and then maybe also from an MDS or maybe a second hospital node, you can merge the information to help create your new one. All right, so let's do the first scenario. So before I do that scenario, I want to give you a high-level overview of how this is set up. So I'm just going to click through these first. So this is the highway, right? That's like the internet. That's the way, or the phone system. That's what's interconnecting all the healthcare organizations in Massachusetts eventually. So it'll be connected to hospitals, it'll be connected to other nursing facilities, you know, home health agencies, you know, physicians. That's what I'll look like in a few more years, you know, as I start from the thin up. And so, and you're sitting over here. You know, here, these are the folks that work in your nursing facility. And you will all have access to the webmail mailbox, like the Gmail mailbox, that's connected to the highway. And so when they send a message, it's going to get sent to your mailbox. And it looks, I'll show you a bigger picture of this. It looks just like a regular mailbox that you're used to seeing. And this is, you're going to use this as a temporary place to hold these messages when they come in. These messages come with attachments that are, those are those transfer summaries. And when you click on that attachment, it's going to take you into C. So this is C here. And you won't even, I mean, it'll look different, so you'll know that you're now in C as opposed to the webmail mailbox. But this is where you're going to actually permanently store all of those transfer summaries that come in, or any drafts that you're working on for a new one that you're about to send out, or any final copies of the ones you're sending out. Those will be stored permanently here. So, and that's important, that you know, after you create a new document that you're about to send, you'll pass it back to the webmail mailbox, and that's how you'll then send it through the highway to the home health agency or the emergency room, wherever it's going. So documents come into the webmail, then they're worked on in C, and then they're sent back here when they're final to be sent to wherever they're going. This is for temporary messaging. You're going to delete all the messages that come in when you're done, when you've transferred into C. C is where all the permanent things are stored. That's also on your test. All right, so let's do that first scenario now, where you're going to receive a document, take a look at it. So the first thing that's going to happen is that you're going to get a text, someone's going to get a text message, you know, letting them know that you've got mail. That person's going to log in to the webmail mailbox, so they'll use whatever user ID and password they've got to log in. They'll see the new mail, they'll click on it, just like you would with any other mailbox, to open the new mail. You'll see the attachment that's there, which is the transfer summary that came from the hospital. You'll click on that, and I'll show you how to do that, and it'll take you into C. And then within C, you'll be able to you'll be looking at the document, you'll be able to print the document, and then when you're done with that, you'll go back to the mailbox, and you're going to delete the original message, because we don't want your mailbox to get cluttered with all these messages. C is the place you want to keep all the documents. Your mailbox you want to keep clean. So this is what the login looks like. So we'll be setting up as a favorite on your computers the address to go to. We'll make a little icon that you can click on to go to the login page. You'll type in your user ID and password, click login, and here's your mailbox. And again, it looks just like almost any other mailbox. It's got, you know, different folders. So you've got your inbox folder, which you're looking at right now. But there is also a drafts folder for things that you were working on that you haven't sent yet. That's not where drafts that's not where you're going to find the documents that you're working on in C. The only thing that'll be in here in drafts are things that were final in C, and now you're working on figuring out where to send it. There is a sent mailbox folder, so that's where you'll find any messages you sent to home health or to me or to the emergency room. Those will be in your sent folder. And then there is the trash folder. And that's important, I'll show you that later, so that if you delete something and you say, oh wait, I want to take a look at that, you can always go back to your trash and see it, to take a look at that. Now, in your inbox, you'll notice that there are two messages here, and that's actually what it's going to look like when you get mail, is because one of these messages you're going to always leave there. So while I said you want to keep your mailbox clean, you're going to always actually want to leave one message there, and I'm going to tell you about that later. But this is the hospital transfer summary that came in, and when you click on it, it shows over here the message, and there may not be anything written, in the message itself, because they're sending it electronically to you. What's most important is sitting down here at the bottom. See the little paper clip? That paper clip tells you that there's something attached to this message, and that's your transfer summary document from the hospital. Now, right below that is this little button that says download. That's what you want to do. You want to download it from webmail into C. So when you click on the little arrow next to the download button, it's going to give you a drop down. It says you can download as a PDF. We don't want that. We can view a printable version. We don't want that. You want this third one that says view using CDA CCD editor. Okay, what it should say is view using C, but it doesn't say that, and I'm going to try to get them to change that. But in the meantime, if it doesn't say C, it says this CDA, CCD thing, that's the one you want. It's the last one. So that's the one you click on. And so when you click on it, it brings you into C. Now notice that C looks different. It's got a different header, it's set up differently, it doesn't have quite the same inbox and sent folders over here. It's different. And what you're seeing right now is your the message, the document that you received from the hospital. And this is just a sample. It's going to look something like this, but not exactly like this. But it'll tell you who the patient is and where it came from. And there's a table of contents with all of these different links. It says vital signs, functional status, allergies, advanced directives. And you could click on one of these, and it'll take you right down to that section of the summary. So that's one of the cool things. As the paper, you'd have to flip through it, whereas if you wanted to quickly jump to advanced directives, you just click there, it goes right to the advanced directives. And you can also use the scroll bar to scroll down to see the rest of the document, that you can scan through it. But what you really want to do with this is you want to print it out. Right? You just received it, you want to print it out for the paper record, and in case you also have to fax it anywhere. So you click on the print button, cleverly named. One thing that you can't see too clearly, but I want you to notice, is that there are actually tabs here. So the first tab, it says Documents. The second tab is that transfer summary that you just received from the hospital. And it says that it's a final status, because you can only send final status documents. You can't send drafts. And it's also got a little X there. That's how you'll close this tab. But you could have multiple tabs. So you could be working with multiple documents from a patient or multiple documents from multiple patients at the same time. So you can actually have a few different tabs open at the same time. So when you click on the print document button, it takes you to this other screen. And then this screen is just to make sure that you've selected the right printer. If you've set up your computer right with the right default printer, it should have your printer located there. You want it in color or black and white. These are the standard printer settings. But probably all you need to do is hit print, and then it'll print this out to the printer. And then when you're done with that, it takes you right back here. So you're done printing. And in fact, you're done with this. You want to go back to your webmail mailbox. So you're going to click on the X to get rid of this tab. And notice what happens. It actually takes you back to the Documents tab in C. You're still in C. You'll always see this logo when you're in C. And this gives you an idea of what C looks like without a document open. Now, this would typically have a list of all the documents that you've received, that you've been working on, that you've sent, would all be listed here for all patients. And you can filter this based on what's clicked on over here. So you could either click on all to see all the documents. You could click on drafts to see the ones that you're working on. You know, maybe you're working on them, getting ready to send. You could look at the ones that are final, so that would certainly be the place to find ones you just received. You can also look at ones you've sent if you wanted to see that. So this helps you sort through this long list. But there's also a search box here. It says search by patient name, document title, or author. So if you wanted to see, for instance, John Smith's summaries, you can type in John Smith and it'll just pull up the ones that are for John Smith. Or if you wanted to find the ones that you worked on, you could type your name in here and it would pull up just those. So you can actually, that's why this is a good place to find all the old documents. But we're done with this. All we wanted to do is get back to webmail, right? So what we're going to do, there's an exit button which I'll show you when you go live, and then that'll take you back to your mailbox here, like just the way you left it. And what you want to do now that you're back here is delete this message. So there's a little trash can in the corner here. We stuck it in the corner so you don't accidentally hit it. And you hit that icon, and that will delete this message. And where does it go when it's deleted?
Trash.
Exactly. And you could click on the trash here and you'll be able to find it if you need it. Very good. Okay. Passing the test. You guys are great. Okay. Yep, that's the trash where it goes. In fact, if you click on the trash, there's the message you just deleted. Here it is. And the fact is that if you clicked on it, downloaded this, it would take you right back into C. Same thing. Also, one trick I'm going to show you later is that if you decided you didn't want to delete that, it was an accident.
Yeah,
you can.
I was going to ask you.
Yeah, there's this button here, which is, these are to reply to all, or to forward. And what you can actually do is you can forward the message right back to yourself. If you do that, it comes back into your inbox. So I'm going to show you that.
Okay.
Yeah, so I'll show you that a little bit later on. But so nothing's really ever lost. So you can't mess up. That's the good thing. All right, so it's 2 weeks later. Patient, well actually before I get into this, any questions about what you just saw? Okay, so it's 2 weeks later, the patient is doing well, they're going to be going home, you're starting to plan their discharge, you can start filling out some of that discharge paperwork before they actually go. So you want to start filling out the summary. And the easiest way to fill out the summary is to start with that hospital summary that they sent to you and just copy the whole thing into a new document and then edit it, as to what's correct and what's not correct. So the steps will be that you're going to first log into the webmail mailbox. And this is important. You can't log directly into C. It's impossible to go directly to C. You always have to start with webmail mailbox. And from there, you can go into C. Now, we did that the last time because we'd had a message and we clicked on the document that we just received from the hospital and we clicked that we were going to download it for that CCD, CDA thing. And that's how we got to C. But right now, you deleted that. So it turns out the only way to get to C is through a message, through an attached document to a message. So that's why we've got in everybody's mailbox this one document that says, used to create new documents, do not delete. And so that's the one message you're going to keep in your mailbox. Try not to delete it, but if you do, you can always forward it back to yourself in case you accidentally do that. And that's going to be the one message that you're going to leave there because that's how you're going to get yourself in when you want to start from scratch or to go find something that you have been working on. So you'll use that. You'll to get to C, you'll go look into C to find the old document that you got from the hospital. You're going to copy that whole document into a brand new document, because you can't edit a final document that you received from the hospital, you have to start your own. You're going to copy that brand new document into it to make one that you're going to use. I'm going to show you how to edit that, and then we're going to save it. We'll save it this time as a draft, because we know that multiple people work on different parts of this. Not one person does the whole thing. One person's got the meds responsibility, somebody else is dealing with what DME they need. So everyone's got their different piece, and so I'm going to show you how you'll save it so that others can also be working on it. And then when you're done with that, you come back to your webmail mailbox and then you can log out. So let me show you the steps. First step, of course, you go into the highway, user ID and password, you log in, takes you to your mailbox. The only thing that's sitting in the mailbox is this one message that we're going to try to always keep there that says, use this to create new documents, do not delete. So it's not just to create new documents, it's also really to get to C so that you can work on old documents as well. So, remember how to get from here into C? What do you do?
Click on download down the bottom.
Exactly, good job. Click on download down here, because here's the attachment, which is just a dummy attachment. It's basically going to be a blank document that we stick here. And you're going to click on this download, then you're going to click on this view using CDA CCD editor, which is cryptic for take me to C. And the first time you go into C, you're going to get some screen that pops up. You'll only see it the very first time. It says, hi there, you're new to C. This is the first time you're using C, and I need to get more information about you. And so what it's going to do is it's going to make sure that we've got your right name, because your name is, whenever you're editing the document, your name gets attached to that document. So it's going to collect your name, it's going to get your credentials if you're an RN or whatever, it's going to collect those. Any contact information about how you can be contacted, that will get recorded. If you're a provider, you may have a national provider identity number, an NPI number, that will get collected as well. So there'll be a few questions that I'll ask you, just and type in what you know, or that is appropriate for you. Some of, may only be that your name is appropriate for you, but at least enter the information that you know. And you'll see that this will actually make it easier for you later on when you're using the system. Since it knows who you are, you don't ever have to enter that information again. So you're done with that, and now you've got this blank document, because that's how you got into C, was by going through that blank document. So here it is, it's a blank document. And we don't really want that blank document, because what we want to do is we wanted to go find the old one that we got from the hospital. So we're going to X out of this document. We'll close that tab by clicking on that X. And now it takes us back to the main table of contents, for a list of all documents. And see that somebody else has been working since we last did this, and now there are a whole bunch more documents in there. I recommend that you always, when you're searching for a document, I recommend you always have it clicked on the All tab, because it may be that someone's already started the discharge draft for you. Someone maybe already got in there before you did, and so you don't want to both be starting from scratch on different documents. So if you do all and then search by the patient's name, you'll find all the documents that are pertaining to that patient, not just the one you got from the hospital, but if anyone else has already started a draft document, you'll see that. And then you'll also see who's been working on it, because it's got the author's name on there, so you'll actually know who's, Nurse Smith got in before I did, so you know who to talk to, so you can coordinate that. Now it turns out, we know that on paper, multiple people are working at the same time to try to get these documents done. Same thing with C. Multiple people can be working on the exact same document, that's okay. You just can't be working in the exact same section at the same time. So if you try to work on the same, if you both are going into the allergy section, the first person who got in there, that's great, they can do their work. The second person who tries to go in gets a warning. It says, this person, it has their name, because you entered it on the first screen, this person is working on this document, so you can't do it. You can talk to them because you know their name now. So that's why we collect the names. So, all right, so we've done the search by name, and here's the document that we found. And we click on that document, and it was a final document, right? So when we got from the hospital, and you notice it says final up here, and here's that print button that we used to print it out the first time. But next to it is this create new document button. What do you think that's for?
Creating a new document.
Exactly. And that's how you get an A+. It's to create the new document. And so when you're creating a whole new document, you're going to start from the old document and push it into a brand new document. And you'll use this create new document button. So when you click on that, it creates a brand new document. Notice it's a draft, it's not final. And it even gives you a little happy message here, import all has finished successfully. So you imported all of that old document into this brand new one and it's successful. Congratulations. So now you're all set to start working on this. You know, it's got, on this table of contents over here, it's gonna have all the different sections, you know, it says advanced directives, allergies, assessments, physical exam, chief complaints. The order of this is gonna change a little bit before you go live, but they're all gonna be here. Every single one of these is a section. And what you wanna do is you really need to look at each of these sections before you finalize this document. Because you're now responsible for everything that you got from the hospital. And if they said something that was wrong or stupid, you need to fix that, or else now you said something wrong or stupid. So you know, with the power, there's responsibility. So you know, you want to go scan through each section, and maybe different people are responsible for different sections. That's something that you probably want to work out in advance. You know, maybe even have an instruction sheet that, you know, these are the people that are going to do these sections. This is the person that's going to do this section. You know, so that everyone knows their roles and responsibilities in advance. So I wanted to give you sort of a general idea of what each section looks like. Okay, because here you are, you know, you've clicked on demographics. Here's the demographics section. But I'm going to kind of blow that up a little bit and show you the different components that are common to every single section. Because they all basically look the same to some degree. So for instance, at the top, it shows you the name of the section. This is the results section. It always tells you the name of whatever section you're working in. Right below that is a copy button. And this is for, you know, what we just did is we created a whole new document, but maybe we just wanted to, you know, we're in the middle of working on this new draft and we want to just pull one section from some other document. Like let's say I have the MDS that got loaded into my mailbox and I just want to pull the functional status from that into this document. You know, that's how when you pull something, you're going to use this copy button. And I'll show you how to do that later. Then there's a section down here on the bottom. I'm going to come to the middle section. At the bottom is this lengthy section in most of these, lengthy piece of this where discrete data is entered. You know, for instance, here's a test result. You're actually putting in that the INR was 2.2 on this date. Or this is their weight at this moment in time. Or this is their blood pressure. Or this was the person who is the proxy. Or, you know, or this is the medication that they're taking. Now you'll enter all of these somewhere down here. And then what happens is whatever you've entered here is copied to this corner here. So there's sort of a very top, there's a middle section that's cut in half, and then there's all this stuff on the bottom. And so anything that's entered on the bottom is copied here for you to see what's been entered. On this other side is where you can type in free text. So you can type in any comment you want. Every section always has a free text section where you can type something in. The other cool thing is you also can paste things into here. So if you were in the medication section, so you're doing the medication list, and down here you would have all of this way that you can put in each medication, you know, the strength of the medication, you know, how often they're taking it, who's responsible, whatever. All that can be filled in here, and you could see a copy of it right here and summarized. Or if you have a system, a pharmacy system where you order the medications and it's keeping track of what the med list is for a patient, you could copy from that and paste it right here, and that essentially will do good enough for your summary. So you need to think about what you could be copying and pasting into the free text so you don't have to enter all the details down here. Because whether it gets here or whether it gets from here to here, this is what's going to show up on the actual summary document. So it's hard to see this here, but what this says is this is the discrete data that you entered down here, is this part, and then over here is the free text that got entered here. They're just merged together, and that's what gets sent on your transfer summary document. So you can either enter stuff here or enter stuff here. Either one will find its way onto the document. There will be some sections that are red, although you can't see that because the color's red's not showing up too well here. But if it's in red, it'll say something like patient's name is required. So if you can't, it's a required field, and you can't finalize this document or even finalize this section until you've filled in the red things. There aren't too many red things, but you know, name is important. Date of birth is important. So that's the kind of, so red things you'll notice that you have to get done. You'll see little calendars periodically on different parts of different sections. If you click on it, it pops up a calendar where you can pick a date and a time. So that, and then you click done when you're done to enter that in here. You could just type right in here a date if you wanted. The other nice thing is a lot of things happen now. You know, this is their temperature, when, now. So you could just click the now button and that'll put today's date and the time right now in this box for you. So you click now, it does it all in one click. There will be places where you have to enter people's names. You know, maybe it's a caregiver, maybe it's a nurse, maybe it's you, and so, or the primary care physician. So you'll see a little head. You know, that's a little head icon means that a person's supposed to go in here. Next to that, you see there's a little star. It says me. If you click on me, it puts your name in there because it knows who you are. You filled it out on the first page. If you click me, it just sticks you in there. Also, there are sometimes that you're entering information that's a physical building, you know, like Beaumont. And so if there's a building icon and you click on me, it's not going to put your name in there. It's going to put your organization in there. It's going to, put whatever your facility name is, it'll stick that in there in that site. Every now and then you're going to see buttons that, that have X's in them, and that's, to delete something. So if you made a mistake here, you can delete it. And or you can just, in most cases, you could just type over things. So you can always correct your mistakes until you finalize. After you finalize, you're done. You own it. There's some other standard fields. So you may see something called the signing authority. And what that really wants to know, that's if you're trying to type in some identification number for, let's say, a patient or a doctor. The assigning authority is the person who creates, like, the social security number. And so you'll select the social security number as the assigning authority, and then you put in their social security number. So that's, and you sometimes will see these little down arrows. Those typically give you drop-down lists of choices. Notice here, this, instead of a little X, this says the word remove. If you click on that, it will remove this. Just that simple. Similarly, over here it says add an identifier, which means you've just entered the social security number, but you also want to enter Medicare number, perhaps. You can click add identifier, and now it gives you a new line that you can enter more information. Now, depending on where you are in the document, there will be different ways to add more lines. Sometimes you'll see an add button at the end. So if you click add, and it puts in a whole new line that you can add another allergy or another medication. Or sometimes there's an add button, here, and if you click on it, in this case, it's going to actually pop up a window where you fill in a whole bunch of information, and you click save, and that's how you get a new line. Or sometimes there's a little plus. Pluses mean add. X's mean delete. So if you click on the plus here, it gives you a new line where you can enter a new line of information. There are also radio buttons. So these are, for instance, in the advanced directive section. Whether you can intubate, whether you should do CPR, whether you should have to give antibiotics, whatever. Each of these has a different line, and you have the choice of clicking no answer, because you haven't discussed it, or you can click yes, or you can click no, but you can only do one of them. You can't be both yes and no. And these will visually show you which one is clicked. So they're called radio buttons. It's easier to see when you get the live system. Some places there are actually check boxes, and these work like regular check boxes where you can check multiple ones. So you can check neither one or both if you want it. Now, when you're done with a section, right now, before you move on to another section, if you've made any changes or edits or additions, you need to click the Save button. So at the bottom of this list of sections is a Save button. So you have to click Save. We're trying to make it so that as soon as you go to the next section, it automatically saves it for you. I don't know if that'll be ready for go live, but we're working on that. So here's the list of sections, and this matches what you've got in your cheat sheet that I gave you. It's got all the sections that you'll be able to use. And you don't have to use them all. Only a few of them are required, as you'll find out as you go through. So I'm going to go through the list of sections and show you what's in them so that you can sort of familiarize yourself with the different sections. So first one is the demographics. So that's standard, their name, their patient's name, their address, information about them. There's also the encounter time, which is in your situation as a nursing facility, it's really the time that they're being discharged, the date, at least the date that they're being discharged. So maybe you may have to change that because it pops in the date that you created this, but you probably will change it when you're doing your finalizing about to send the patient on your way. The patient's name, guardian, next of kin. Right now, this says sending site. That's you when you send this patient to a place. Custodian is right now. I'm trying to get the name changed. Custodian is really the organization that was holding on to the patient, which is also you. So custodian can be very confusing. We'll come up with a better term for that. You can also put the date the patient arrived here. So in other words, what was their admit date is down here in the corner. Also in the demographics is the care team. So who's the primary caregiver at home? Who's the PCP? Who's responsible for the care plan? Who gives most of the patient's health care? Are there other members of the care team? So you don't have to fill all this in, but fill out what you feel is relevant and makes sense to you. You can also add document authors. So right now, it's not automatically displaying all the names of the authors. And what some organizations are doing is they want to, there may be 3 of you or 4 of you that are responsible for different parts. And what they're considering doing is when you're done with your part, you enter your name as a document author. So that when someone else comes along, they know that when all the document authors' names are in there, it means everyone's done with their pieces and this is ready to ship. So it's in demographics, you may want to consider using that. And here's one name, but if you want to add yourself as the document author, you click plus me. It adds you as the author. One click, you're done. Very simple.